There is a huge scientific and societal pressure that's growing on the COVID anti-vaxxers that are still refusing to get the coronavirus vaccine, as we are now starting to see more than half of the United States see an increase in cases, thanks mostly to the very contagious Delta variant spreading, in particular among unvaccinated people. And of course, because no vaccine is 100% effective of the COVID vaccines that we currently have, by sheer math, also picking off some people who did do the right thing and did go and get themselves vaccinated. And so it's overwhelmingly happening in the least vaccinated counties. This is translating to happening more in red states than in blue states. And yesterday, I already told you about the stunning numbers which show that in May, I mean, look at this, in May, 99.2% of those who died of coronavirus were not vaccinated, while 0.8% of those who died had been vaccinated. Maryland says that 100% of COVID-19 deaths last month were among the unvaccinated. So this is no joke. The numbers are, to call them overwhelming is really an understatement. And it's getting so bad. In other words, the impact of not being vaccinated is so huge on a country or a state or even on a county's health system that people are going crazy trying to figure out what is it going to take to get people vaccinated so that we can stop the development of new variants and the evolution of new variants and stop the spread among mostly unvaccinated people, but still affecting the vaccinated as well, because no vaccine is 100% effective. Now, in the United States, we're not going to see government mandatory vaccinations. Employers can certainly legally require employees to be vaccinated in most cases to go back to an in-person working situation. Some countries are taking a much more authoritarian approach. We're not going to see this in the United States. But Tajikistan and the Vatican are imposing mandatory vaccination on adults, straight up, period. In Italy, there are several counties or territories that have imposed mandatory vaccination on certain sections of the population. Italian doctors and health workers in both the public and private sector must be vaccinated, or they will face not being allowed to work directly with patients, which will make it really difficult for them to do their jobs. The British government in mid-June said all home care staff must be fully vaccinated to continue working. Kazakhstan on July 1st ordered mandatory coronavirus vaccinations for a wide range of workers who come into contact with others. Now, in the United States, we're not going to see that. I'm not an advocate of that. I am an advocate of people getting vaccinated, and we have to figure out how to get them to do it. We have some examples in the U.S., like the city of San Francisco. They've said it's going to require municipal employees to be vaccinated, or they could face penalties up to and including dismissal. But that's only when there's full FDA approval of the vaccine. Houston Methodist Hospital in Texas, more than 150 employees have been fired or resigned because they didn't comply with their employer directive to get themselves vaccinated. The Delta variant is less well handled by the current vaccines, and we're already seeing a more contagious Lambda variant appear in Australia. We still don't know that much about it. So, this is the key time. Do we want a resurgence of this in the fall? Do we want to have to go back this fall to the direction of, hopefully not as bad, but the direction of the way things were last fall? And yes, almost half of U.S. reports of U.S. states are reporting rising cases, largely because of this Delta variant. About 157 million Americans right now, 58% of U.S. adults are fully vaccinated. 67% of U.S. adults have had at least one shot. We are getting there. We did not meet Joe Biden's goal of 70% by July 4th. Hopefully by next week, this weekend or early next week, we will get to that point. But what is it going to take to get these people vaccinated? Because otherwise it will be more variants and more spread. And eventually it will be more deaths as well if we get a variant that really evades the vaccines and has a higher death rate. Understand that to say that we've been lucky about anything in this pandemic, it feels crass. It feels outrageous to say. But I encourage you, read Lawrence Wright's latest book, The End of October. It's a novel. It's fiction, but it's clearly based around a coronavirus-like global pandemic. We're lucky that the real world coronavirus, for now, doesn't have nearly the death rate that the imaginary virus in Lawrence Wright's book, The End of October, has. Because if we had, and we could have, a much more deadly variant, the numbers will be even more horrifying than what the US and the world has already endured. So what'll it take to get these folks vaccinated? I know about a third of them say, if there is full FDA approval, I will go and get vaccinated. That's about a third of the currently vaccine hesitant based on a poll from a few weeks ago. Do I believe a full third of them are really going to get vaccinated when there's FDA approval? No, I imagine some will say, okay, well, let me now give it a few months that it's been FDA approved fully rather than just as emergency use. Some of them will, some of them won't. What will it take to get more people vaccinated? At this point, I don't know. Will it be required vaccinations to go to sporting events? Will it be required vaccinations to travel? A lot of these folks don't travel anyway. I don't know what the answer is, but it's very scary. And we are seeing in the numbers what we could be facing very, very soon. During the pandemic, and even at this point, I try to avoid physically visiting a doctor's office unless I really have to. And that's why I love our sponsor, SteadyMD Primary Care. You take a quiz, you get matched with a licensed primary care physician who's a good fit for you. You have a 1-hour virtual appointment and you start a meaningful relationship with your new doctor. After that, your doctor is available to you anytime by text, phone, and video chat. And unlike other services, this isn't some random doctor on call. Each doctor at SteadyMD has a limited number of patients so they can give you the personal attention you deserve. They can help you with anything your primary care doctor normally would: healthy diet, managing conditions, weight loss, sleep, depression, anxiety. You don't need insurance. It's just $99 a month with absolutely no other fees or copays for visits. Take the free quiz and see which doctor is a perfect fit for you. Go to steadymd.com/Pakman. There's no risk, no long-term commitment. The link is right underneath this video.